This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
Weekly news update coming to you from the Health Broadcasting Service HBS radio channel. Lilly, Novartis join drugmakers in scaling back operations in Russia. A growing number of drugmakers including Eli Lilly & Co., Novartis and AbbVie Incorporated are scaling back business in Russia after Moscow's invasion of Ukraine, but still pledged to continue supplying critical medicines. U.S. drugmaker Lilly said it will send medicines for urgent medical conditions such as cancer and diabetes. It is suspending sales of what it called non-essential medicines as well as all investments and promotions. It also will not start any new clinical trials there. Swiss drugmaker Novartis also said it would stop investments, marketing activities there and all scientific events organized by the company or external parties in Russia. U.S. drugmaker AbbVie, which owns blockbuster wrinkle treatment Botox, said it has temporarily suspended operations for all its aesthetics products in the country. Johnson & Johnson Incorporated said it was stopping enrollment in Ukraine, Russia, and Belarus as well as any openings of new sites, but was committed to providing essential health products. On Monday, Pfizer Incorporated, Germany's Bayer, and Abbott Laboratories had pulled back from non-essential spending in the country. Pfizer and Bayer said they would maintain a supply of medicines to Russia. Western companies have come under pressure to leave Russia, but the healthcare sector has not pulled out because medicine and medical devices and equipment are considered necessary for humanitarian reasons and are excluded from sanctions. While it is good to see large corporations, including in the pharmaceutical space, take a proactive stand against war and aggression, any step to suspend medical supplies, even for non-essential items, could end up putting the health of patients in Russia at risk, said Anant Pan, a global health and bioethics researcher. Getting supplies in has already become tougher. Sanctions have cut off Russian banks from the international financial system, while shipping companies have halted services to the country, interrupting delivery of medical supplies. In a post titled, Lilly and Lilly Foundation provide support for people in Ukraine, on its website, Lilly said any profit from continued sales in Russia will be donated to organizations dedicated to humanitarian relief. Lilly is the first to exclude drugs it designates as non-essential. The company told Reuters in an email that an example of a non-essential medicine was Cialis, a branded erectile dysfunction treatment available from other sellers as a generic drug. It did not disclose specific treatments affected by the decision. Illumina launches multiple gene test to spot rare treatable cancers. Genome sequencing group Illumina on Tuesday launched a cancer test in Europe that checks for a wide range of tumor genes in one tissue sample, potentially helping patients with rare diseases to be matched up with treatment options. The test, which Illumina says scans for more mutations than any available kits, comes amid drug industry efforts to develop precision oncology drugs for ever smaller patient groups defined by a genetic profile. This has created pent-up demand for more sophisticated diagnostic tools. Illumina's TrueSight Oncology Comprehensive Test Kit scans for 517 cancer-relevant genes across nearly 30 solid tumor types, it said in a statement. For instance, it reads out a patient's mutational burden score and microsatellite instability status, which cancer researchers have said indicate the need to be given immune drugs such as Merck and Company's Keytruda. Also included is the TRK mutation, which is a genetic driver in less than 1% of cancers and, due to its rarity, often goes untested even though Bayer's Vitrakvi and Roche's Rozlytrek are available as approved treatments. Bayer has said it was struggling to encourage physicians to diagnose patients that qualify for the niche drug. Consolidating all of the critical biomarkers into a single comprehensive test improves the chances of identifying treatment options that would otherwise require time-consuming sequential gene tests from multiple biopsy procedures, Illumina said. The launch comes as Illumina is struggling to win over EU antitrust regulators for its planned $8 billion bid for Grail Incorporated, which is working on blood tests to diagnose early-stage cancers. Illumina said it was preparing to file for US regulatory approval for the test kit later this year. Access to the European medical devices and diagnostics market is easier because manufacturers routinely go through a process of self-certifying that their products function as stated, without a regulator as gatekeeper. White House to reopen to public tours as Omicron fades. The White House will reopen to the public next month after being shuttered 2 years amid the COVID-19 pandemic, it said on Tuesday, with the U.S. Capitol reportedly also weighing plans. The White House will open for tours starting April 15, 2 days a week, it said in a statement, adding that masks are optional and those who have tested positive for the novel coronavirus or are otherwise possibly ill should not attend. Congress is also weighing a phased reopening starting March 28 and moving toward a full reopening by September 5, The Washington Post reported, citing an unnamed source. The moves this spring come as U.S. COVID-19 cases continue to decline following the Omicron variant-driven spike, even as mounting cases in Europe and China have raised some concerns about the potential for another wave. The White House will continue to closely monitor the COVID-19 situation with guidance based on recommendations from the CDC and other public health officials and medical experts, and will adjust availability, as necessary, it said. White House spokeswoman Jen Psaki on Monday acknowledged likely fluctuation in U.S. cases, while the White House separately on Tuesday sought more U.S. funding to manage current cases and bolster the nation's long-term preparedness, including for future variants. We have made tremendous progress in our fight against COVID-19, but our work isn't done, Biden tweeted on Tuesday. Washington officials have followed leaders in all 50 states in lifting most coronavirus restrictions. 2 of the Smithsonian's attractions this week also reopened 7 days per week, though it said, for now, most of its museums will remain on modified schedules. Pfizer Incorporated, meanwhile, is seeking U.S. approval for a 4th vaccine shot in people aged 65 and older, the Post reported separately, as leaders also promote vaccinations. Representatives for the U.S. Capitol Police did not respond to a request for comment on the Washington Post report. Another concern for the Capitol remained security following the deadly January 6, 2021, attack. World Health Organization say global rise in COVID cases is tip of the iceberg. Figures showing a global rise in COVID-19 cases could herald a much bigger problem as some countries also report a drop in testing rates, the WHO said on Tuesday, warning nations to remain vigilant against the virus. After more than a month of decline, COVID cases started to increase around the world last week, the World Health Organization said, with lockdowns in Asia and China's Jilin province battling to contain an outbreak. A combination of factors was causing the increases, including the highly transmissible Omicron variant and its BA.2 sublineage, and the lifting of public health and social measures, the World Health Organization said. These increases are occurring despite reductions in testing in some countries, which means the cases we're seeing are just the tip of the iceberg, World Health Organization's head Tedros Adhanom Ghebreyesus told reporters. Low vaccination rates in some countries, driven partly by a huge amount of misinformation, also explained the rise, World Health Organization officials said. New infections jumped by 8% globally compared to the previous week, with 11 million new cases and just over 43,000 new deaths reported from March 7 to 13. It is the first rise since the end of January. The biggest jump was in the World Health Organization's Western Pacific region, which includes South Korea and China, where cases rose by 25% and deaths by 27%. Africa also saw a 12% rise in new cases and 14% rise in deaths, and Europe a 2% rise in cases but no jump in deaths. Other regions reported declining cases, including the Eastern Mediterranean region, although this area saw a 38% rise in deaths linked to a previous spike in infections. A number of experts have raised concerns that Europe faces another coronavirus wave, with case rising since the beginning of March in Austria, Germany, Switzerland, the Netherlands, and the United Kingdom. The World Health Organization's Maria van Kerkhove said at the briefing that BA.2 appears to be the most transmissible variant so far. However, there are no signs that it causes more severe disease, and no evidence that any other new variants are driving the rise in cases. The picture in Europe is also not universal. Denmark, for example, saw a brief peak in cases in the first half of February, driven by BA.2, which quickly subsided. But experts have begun to warn that the United States could soon see a similar wave to that seen in Europe, potentially driven by BA.2, the lifting of restrictions and potential waning immunity from vaccines given several months ago. I agree with the easing of restrictions, because you can't think of it as an emergency after 2 years, said Antonella Viola, professor of immunology at Italy's University of Padua. We just have to avoid thinking that COVID is no longer there. and therefore maintain the strictly necessary measures, which are essentially the continuous monitoring and tracking of cases, and the maintenance of the obligation to wear a mask in closed or very crowded places. Feel free to connect with us on our Facebook platform, at Health Broadcast, and our website at www.healthbroadcastingservice.com. Please remember to press the subscribe button to stay abreast of timely, vital, and authentic health news developments from around the world, delivered to you by the Health Broadcasting Service on our YouTube channel. We will bring you more updates as news develop. Stay safe, remain healthy, and bye for now.
You've been watching the Health Broadcasting Service YouTube channel, your channel of excellence and distinction. Pioneering specialist radio broadcasting, giving you the best experience. Subscribe to our channel.